Hello. I'm sharing my screen. Hello. As a result of the COVID-19 pandemic, large numbers of doctors and nurses of all specialties are being diverted to intensive care unit management. Often, young and inexperienced staff are being deployed in ICUs. Evidently, there is a sharp increase in demand for rapid clinical training for ICU procedures. The lockdown and self-isolation have also caused additional demand for remotely accessible training. At Epicardio, we have developed a cloud-based real-time 3D electromechanical simulation of the heart that helps medical students, medical schools, and cardiac devices industry to fully master the complexities of the heart. In order to address this new need, we set out to adapt our heart simulator for ICU training. We have introduced an entirely new approach to training in temporary cardiac pacing based on validated real-time interactive 3D heart simulation. Temporary cardiac pacing is one of the critical interventions frequently used in ICU patients. It is one of the first hands-on procedures physicians and nurses perform as residents and trainees. The application consists of a virtual heart in various arrhythmic states and an interactive pacemaker with real-time changes in pacing rate, voltage, sensitivity, and mode. Self-study tutorials introduce the procedure, and tests allow trainees to access and assess learning outcomes. Confidence and experience gained from simulated training can help make first procedures successful and decrease risk to patients. It was developed for healthcare professionals and medical and nursing students who are interested in a deeper understanding of temporary cardiac pacing procedures. This app employs interactive real-time 3D exploration into cardiac pacing to aid learning and uses rendered 3D anatomy, interactive pacing tip placement, and interactive control of pacing parameters. Utilizes electrophysiology simulation and on-screen live ECG signals to simulate the effect of the pacing device on the heart rhythm for realistic training. Users can perform a temporary pacing procedure, take readings with common results, and use pathologies that may not have had access to previously. The training objectives are the following: understanding what causes the ECG signals during a pacing procedure, understanding how to set the pacing mode, voltage, sensitivity, and thresholds, etc., learning best practices for temporary cardiac pacing, and exploring the 3D heart and gain spatial and temporal understanding of the pacing procedure. The benefits from using this app are as follows. Users can access individualized simulation training on their personal devices anytime and anywhere. Guided tutorials and self-learning without need for tutoring. Normal and versus pathology overlays make it easy to visually compare differences in pacing that would otherwise need to be imagined. Spatial and temporal understanding of what causes the ECG signals helps with retention. And finally, interactive exercise mode allows users to complete a case and receive feedback on performance, helping them to identify any knowledge gaps. This project has allowed us to meet an urgent medical training need and at the same time expand our expertise. The results were validated by and are currently used at Oxford, Leeds and Middlesex University Hospitals in the UK and at Karolinska Institute and Örebro University Hospitals in Sweden. The app was developed using Unity 3D and Xcode and is available on iOS and Android tablets and also on macOS and Windows systems and on all WebGL web browsers. Thank you.